Welcome, curious minds, to another deep dive. Our bodies are, well, truly intricate systems, aren't they?
They really are.
A complex network where, every part affects the whole, and sometimes a problem in one area can trigger surprising, far-reaching ripple effects.
Definitely.
Today, we're going on a deep dive into one of our body's most vital organs and a condition that can fundamentally change it: liver cirrhosis.
A really crucial topic.
Yeah, and our mission today isn't just to define this condition. We want to take you step by step through the intricate process of how it develops, what truly triggers it, and the cascading consequences it unleashes throughout the entire body. We'll be drawing from the detailed source material you've shared with us, giving you a shortcut to being truly well-informed on this critical topic.
And what's particularly insightful here, I think, is that while many might immediately associate liver cirrhosis with just one cause, maybe like excessive alcohol.
Right, that's the common association.
Exactly. But it's actually the end stage of many different chronic liver diseases, which, broadens our perspective significantly when we think about its origins and, crucially, how we might prevent or address it.
That's a really important distinction to make right off the bat. So, okay, let's lay the foundation. What exactly is liver cirrhosis? The source defines it as the end stage of chronic liver diseases. What does that actually mean in practical terms?
It means the liver has undergone this really profound transformation. It's characterized by three key things. First, fibrosis, which is basically scar tissue building up.
Scarring. Right?
Then there's nodular regeneration. This is where the liver tries to heal itself, but it creates these disorganized clumps of cells instead of nice orderly tissue.
So not a helpful kind of healing.
Not really, no. And third, there's a severe distortion of the liver architecture. The normal, efficient structure gets completely scrambled.
Oh.
And ultimately, all this leads to progressive liver dysfunction and a major complication called portal hypertension. We'll definitely talk more about that.
Okay, that description really drives home the end stage idea. But what actually starts this whole destructive process? What are the main triggers, the things that set the liver down this path?
Yeah, that's a crucial point because the causes are incredibly diverse. Our source highlights the most common one, accounting for roughly 70% of cases.
70%? That's huge.
It is. That's alcoholic liver disease. But like I said, it's far from the only one.
Right.
Other major players include chronic viral hepatitis, particularly hepatitis C virus or HCV.
Okay.
We also see autoimmune hepatitis. That's where the body's own immune system mistakenly attacks its liver cells.
Body attacking itself.
Yeah. Then there are cholestatic diseases like primary biliary cirrhosis, which mess with bile flow, and then a whole range of hereditary or metabolic disorders.
Be quiet.
Well, for instance, hemochromatosis, which involves iron overload, that's about 5% maybe, and Wilson's disease, which is due to copper buildup.
So a lot of different routes to the same endpoint.
Precisely. And understanding the specific cause is absolutely critical for diagnosis and, of course, for effective management down the line.
Okay, this next part is where it gets really interesting for me. We've talked about what cirrhosis is, but how does this whole destructive process unfold? Let's break down that step-by-step journey from, say, chronic injury to full-blown cirrhosis. How does this architectural distortion actually happen at a cellular level?
It's a truly insidious process.
Yeah.
Imagine your liver like a perfectly organized city grid. Roads, buildings, all laid out for efficient transport and function.
Okay, got the visual.
This journey starts with chronic liver injury. Repeated damage to the main liver cells, the hepatocytes, triggers persistent inflammation.
Okay, the inflammation is the spark.
It's a huge part of it.
Yeah.
And this inflammation activates specific cells called ETO cells, or stellate cells. They normally just kind of hang out quietly in the liver's tiny spaces, the space of DISI, like sleeping security guards.
Yeah.
But once activated by that chronic inflammation, these ETO cells transform. They stop being quiet guards and start furiously producing and depositing vast amounts of collagen.
Collagen, like scar tissue.
Exactly like scar tissue. Think of it like that. This collagen forms fibrous septa. These are essentially dense walls of scar tissue that start crisscrossing the liver.
Walling things off.
Right. And these walls then encircle the regenerating liver cells, creating these chaotic, disorganized clumps we call nodules. So that organized city grid, it gets replaced by these isolated nodules separated by thick scar tissue walls. The liver is essentially building its own prison, changing its structure from the inside out.
So it's not just passive scarring, it's an active, destructive remodeling.
Yeah.
What does that do to the blood flow? Because the liver needs massive blood flow.
Absolutely vital. And that brings us to the second critical step. Vascular remodeling, which leads to something called arterialization.
Arterialization.
Yeah. So normally, the liver's tiny blood vessels, the sinusoids, they're incredibly porous. Think of them like super fine sieves with lots of tiny windows or fenestrations, perfect for filtering blood and letting nutrients easily reach the liver cells.
Makes sense.
But in cirrhosis, this gets completely disrupted. The growing scar tissue and abnormal new blood vessel growth create arteriovenous shunts.
Sharts, like bypasses?
Exactly.
Yeah.
Rogue shortcuts where blood vessels connect directly, completely bypassing those crucial filtering sinusoids.
So the blood isn't getting filtered properly.
Not only that, but the sinusoidal endothelial cells,
Yeah.
the cells lining those sieves, they lose their fenestrations. Those little windows slam shut.
Oh, wow.
This physically isolates the hepatocytes, the liver cells, from the blood. It severely limits their ability to do their jobs, detoxification, protein synthesis, all of it.
So even if some cells regenerate?
Exactly. Even if some liver cells manage to regenerate, they remain disconnected from the blood supply, leading to widespread functional failure. It's like having houses in your city, but no roads leading to them to deliver supplies.
Okay, so the architecture is distorted, the blood flow is rerouted and blocked, even new cells are cut off. This sounds like a recipe for a massive pressure buildup somewhere. Is that where portal hypertension comes in?
That's precisely it. The third critical step. Think about trying to push water through a garden hose that's getting progressively clogged with mud.
The pressure behind it skyrockets.
Right. That increased fibrosis and architectural distortion significantly raise the intrahepatic resistance to blood flow within the liver itself. So the portal blood, which carries nutrient-rich blood from the gut and normally flows through the liver.
It can't get through easily anymore.
Correct. It's forced to divert through alternative high-pressure bypass routes called portosystemic collaterals.
Those shunts you mentioned earlier.
Well, these are larger collateral pathways that develop outside the liver, too. A classic example you hear about are the esophageal veins. These veins in the esophagus just aren't built to handle that kind of intense pressure.
Sounds dangerous.
It is. And also, the increased flow trying to get out through the hepatic veins also contributes to more congestion and further arterialization inside the liver. It's a vicious cycle.
And is there anything else breaking down structurally?
Yes, there's a fourth point. As the damage progresses, you also see a loss of bile ducts. These crucial tubes that carry bile out of the liver get destroyed. This worsens cholestasis, the backup of bile, adding another layer of toxic buildup and dysfunction.
So, okay, the liver structure is wrecked, blood flow is messed up, pressure is high, bile flow is blocked. What does all this mean for the rest of the body? The liver does so much, the consequences must ripple outwards significantly.
They absolutely do. The consequences are widespread, and yeah, many of the most severe are driven by that increased pressure. Portal hypertension, that's a major driver.
Right.
First, you get ascites and edema. That's fluid buildup in the abdomen, the ascites, and swelling, usually in the legs, the edema.
Why does that happen?
That's a chain reaction. Portal hypertension causes massive expansion of blood vessels. In the gut area, we call this splanchnic vasodilation.
Okay.
This huge vasodilation means less blood effectively returns to the heart and kidneys, leading to renal hypoperfusion. The kidneys think the body is dehydrated.
Even though it isn't.
Right. So they activate the RAAS, the renin-angiotensin-aldosterone system, which tells the body to hang on to salt and water.
Ah, leading to fluid overload.
Exactly.
Yeah.
Plus, the failing liver isn't making enough albumin protein. That's hypoalbuminemia. Albumin helps keep fluid inside blood vessels, so with less albumin, fluid leaks out more easily into tissues, worsening the edema and ascites.
And those collateral blood vessels, those dangerous detours. You mentioned esophageal veins.
Yes, those portosystemic anastomoses become incredibly dangerous. The most critical are esophageal varices. Think of them as swollen, fragile veins in the esophagus, like thin balloons ready to pop.
And if they pop?
They can rupture, leading to potentially life-threatening hematemesis that's vomiting large amounts of blood. Very serious.
Wow. Are there other signs of these collaterals?
You might see caput medusae, these distended veins radiating out from the belly button on the abdomen. Looks a bit like a jellyfish head, hence the name. And also hemorrhoids, which are essentially rectal varices caused by the same pressure backup.
Okay. And what about the spleen? Does portal hypertension affect that too?
It does. You often get splenomegaly, which is just an enlarged spleen, and something called hypersplenism. The venous congestion backs blood up into the spleen, making it swell.
Right.
And this enlarged, congested spleen starts trapping blood cells, especially platelets. This leads to thrombocytopenia, a low platelet count, which increases bleeding risk even more.
So beyond the pressure problems, the liver itself is just Failing at its basic jobs, right?
Mhm.
Making proteins, detoxifying things.
Exactly. That's the broad category of liver dysfunction. When protein synthesis decreases, you see several issues. We mentioned hypoalbuminemia causing edema.
Yes.
Critically, there's also coagulopathy. The liver makes most of our clotting factors, so when it fails, patients don't clot properly and are prone to serious bleeding.
Double trouble with the low platelets and poor clotting.
Absolutely. And patients often experience generalized muscle wasting and fatigue, partly due to the lack of essential proteins and overall metabolic disruption.
And the detoxification role. What happens when that fails?
That's also critical. One of the most severe results is hepatic encephalopathy. The liver can't effectively process toxins anymore, especially ammonia and HRO, which is a byproduct of protein breakdown in the gut.
Ammonia builds up.
It builds up in the blood, crosses into the brain, and causes neuropsychiatric symptoms. This can range from mild confusion, personality changes, forgetfulness, all the way to profound disorientation and potentially coma.
That sounds terrifying.
It is. We also see hyperestrogenism. The failing liver can't break down hormones like estrogen properly. In males, this can lead to gynecomastia, which is breast tissue enlargement, and testicular atrophy.
Hormonal chaos, too.
And finally, the liver processes bilirubin, a breakdown product of red blood cells. When that's impaired, you get hyperbilirubinemia, causing jaundice or icterus, that characteristic yellowing of the skin and the whites of the eyes.
It really sounds like a systemic breakdown, originating from the liver but affecting almost everything. Are other organs directly hit? Like the kidneys you mentioned earlier?
Yes, absolutely.
Yeah.
A very serious, often fatal complication is hepatorenal syndrome. Now, this isn't a primary kidney disease. The kidneys themselves might look okay initially.
But they fail anyway.
It's a functional renal failure.
Right.
Basically, that severe splanchnic vasodilation we talked about tricks the body. The kidneys sense low effective blood volume and react by constricting their own blood vessels dramatically.
It's trying to boost pressure.
Yes, but it backfires. They constrict so much that they starve themselves of blood flow, leading to kidney failure, even without direct kidney damage. It's the liver failure causing kidney failure.
Wow. What about infections? Is that a risk?
A major risk. Because of the gut congestion from portal hypertension and the generally weakened immune state in cirrhosis, bacteria from the gut can leak into the bloodstream or abdominal cavity more easily. That's called bacterial translocation.
And that causes infection.
It can lead to very serious infections, like spontaneous bacterial peritonitis or SBP. That's an infection of the fluid in the abdomen, the acidic fluid. It's a medical emergency.
Goodness. And one more thing. Cancer risk.
Yes, unfortunately. Liver cirrhosis significantly increases the risk of developing hepatocellular carcinoma, HCC, which is primary liver cancer.
Why is that?
That constant cycle of damage, inflammation, and abnormal cell regeneration in the cirrhotic liver creates what we call a precancerous environment. It makes it much more likely for mutations to occur and cancerous cells to take hold and grow.
Okay, so given this incredibly complex picture, all these changes, these widespread symptoms, how do doctors actually diagnose cirrhosis and figure out how far it's progressed?
It's definitely a multifaceted approach. Diagnosis usually involves several key pieces. First, liver function tests, LFTs, from blood work. These look at liver enzymes like transaminases, bilirubin levels, albumin levels.
The things you mentioned getting disrupted.
Exactly. And the INR, the International Normalized Ratio, which measures blood clotting time, a key indicator of synthetic function.
Okay.
Then imaging is huge. Ultrasound is very common to look at the liver size, texture, and blood flow. And elastography, often known by the brand name FibroScan, is really valuable.
Cyberscan, what's that?
It's a non-invasive test, kind of like an ultrasound that measures liver stiffness. More stiffness generally means more fibrosis or scarring. Gives a good sense of how advanced the scarring is.
So you can track the fibrosis level?
Yes. Clinicians also rely heavily on the clinical signs we've discussed, seeing ascites, feeling an enlarged spleen, evidence of variceal bleeding, seeing caput medusae on the abdomen.
Bring the whole picture together.
Right. And crucially, they need to figure out the underlying cause. So specific lab tests are essential. Checking for hepatitis B or C antibodies, looking at iron levels like serum ferritin and transferrin saturation for hemochromatosis, or measuring ceruloplasmin for Wilson's disease.
Got it. Find the cause to treat it, if possible.
If possible, yes, or at least manage it.
This all paints a very clear, though quite grim picture of the potential progression. It leads to the tough question. What are the ultimate, most severe outcomes? What does the source identify as the main ways people die from cirrhosis?
Yeah, it's sobering. The main causes of death really reflect the severity of the complications we've just walked through. They are, number one, outright liver failure, where the liver just cannot sustain life anymore.
Total shutdown.
Pretty much.
Yeah.
Number two, massive xerosol bleeding, usually from those ruptured esophageal varices we talked about. That can be catastrophic very quickly.
Yeah.
And number three, the development and progression of hepatocellular carcinoma, HCC, the liver cancer.
Liver failure, bleeding, cancer. Devastating endpoints. Wow. We have covered a lot today. We've really taken this incredible journey, haven't we?
Yeah.
Through the liver, from that initial chronic injury, through the fibrosis and the architectural distortion.
This whole remodeling process.
Yeah, and then seeing how those changes lead to portal hypertension and then these cascading effects that ripple throughout the entire body. It just underscores the incredible interconnectedness of our systems.
It really does. How a problem in one organ can lead to such a wide array of, frankly, devastating symptoms elsewhere.
Yeah.
And, understanding these detailed mechanisms, it really helps us appreciate maybe the fragility of our organ systems sometimes, and the critical importance of addressing chronic inflammation early, whatever the cause. It makes you wonder, doesn't it? Well, thinking about prevention or early intervention, what aspects do you think hold the most promise for people facing these chronic liver conditions, especially knowing there are so many different pathways that can ultimately lead to this end-stage disease? Something for all of us, and you listening, to consider.